After weeks of warning, it's now a waiting game. Health officials from federal to local levels ask people not to travel for Thanksgiving.
Still, many did, meaning there could be a surge in COVID-19 cases coming. We won't know if the spread has increased or if it has, just how much, for probably another week. Symptoms can lag up to 14 days.
Yeah, that's right. And healthcare workers are now preparing for that influx of patients, possibly as the holiday season rolls on. Reporter Marielle Carbone spoke to a nurse who says it feels like a losing battle.
Well, one Ohio nurse tells me that it is frustrating to see people posting pictures of family gatherings and traveling despite those warnings from health experts. And she fears it will only get worse as we head into Christmas and New Year's. For health officials scrambling to care for patients, COVID-19 and the long-term effects, death or disability, are no joking matter.
I would hate to die. I have a 15-month-old daughter. It breaks my heart to think about her growing up with no memory of me. But it also terrifies me to think that I might not die from it, that I might end up with a permanent disability.
So to watch people risk spreading it. Traveling and gathering for Thanksgiving is frustrating for registered nurse Megan Adams.
And it looks like it's going to get so much worse, and that's really frightening.
She's now preparing for a surge in COVID-19 cases as a result, and fears it'll only get worse.
I unfortunately think there's going to be a really stark wake-up call as we get into Christmas and into New Year's, and I really hope we're available to meet that challenge.
It's already a challenge in Southwest Ohio.
60 days ago, in our hospital systems, about 1 in 30 individuals in the hospital had COVID. We're now at a point where about 1 in 4.
That translates to a nearly 700% increase in the number of people hospitalized in our region just over the past 2 months. Dr. Richard Lofgren, CEO of UC Health, says the biggest threat to response efforts is staffing levels.
We're asking people and nurses to work overtime or double shifts and to sort of stretch themselves. And obviously, in some cases, that's not sustainable.
Adams agrees.
At a certain point of overload, we are inevitably going to reach a point of failure.
It'll be another week before the hospitals start to feel the impact of Thanksgiving travel, as symptoms can lag. Adams is hoping as the next holiday approaches, people will keep in mind the consequences their actions could have.
Just completely demoralizing and disheartening to feel like there are going to be people who desperately need you that you're not going to be able to be there for them.
And to prepare for any surges, local hospitals are expanding their bed capacities, and the Hamilton County Health Department is hiring more contact tracers. Reporting in Corryville, Marielle Carbone, WCPO 9 News.